1 in 20 people develops colorectal cancer in their lifetime, making it the second most common cancer in Europe. Sure, a surgery is an option, but this can result in incomplete removal of the tumor. Now, researchers from MIT develop a hydrogel patch with 3 types of therapy applied directly to tumors in colon, which, after tested on lab mice, cause cancer to go into a complete remission. I'm Lučka Bibić, and I spoke with Dr. Natalie Artzi from MIT.
So cancer is one of the leading causes of mortality in the modern world, with more than 10 million new cases every year. In fact, advances in diagnosis and treatment of this disease that kills millions of people each year worldwide haven't been as effective as for other chronic diseases.
Which approach did you use to nip the evil in the bud?
We developed a prophylactic patch that efficiently combats cancer. It is made out of soft hydrogel patch, similar to Jell-O that we eat, that sticks to the tumor like a glue and releases therapeutic cargo over time. The patch wages 3-way attack on the tumor.
Wow, so definitely a patch that delivers cancer drugs. The only patch that I used is Band-Aid, but yours is like a triple threat therapy, working straight at the cancer. How does it do it?
The patch is made of a mixture of polymers that form a gel when mixed together. The gel contains 2 types of nanoparticles. Spherical nanoparticles carry an siRNA sequence, which is a molecule that is able to shut down an oncogene that has the potential to cause cancer.
And how did you come up with the idea of using nanoparticles?
We can design nanoparticles that can efficiently enter cells and deliver drugs to the cells very specifically. Besides, these nanorods have the capacity to heat up when irradiated with an infrared light source to facilitate tumor destruction. We hypothesized that using a patch that supports local drug delivery applied directly to the tumor site, we would be able to overcome some of the hurdles associated with conventional systemic application of chemotherapy, and triple therapy patch prevented cancer recurrence following tumor resection, unlike the untreated group in which 40% of the tumors recurred following resection in a colon cancer mouse model. When the patch was used as a prophylactic measure following tumor resection to prevent cancer recurrence, complete remission was achieved.
So I guess we can say that in 40% of cases where the patch was not applied, the cancer returned. But when the patch was applied after surgery, you get a complete remission.
Yes, this is correct. The patch can serve as a treatment that is given as a first step to shrink the tumor before the main treatment, which is usually surgery. When we applied the patch to the tumor shrunk in more than 90%, thus eliminating the need for surgery.
So in your work, you deliver a gene therapy to suppress an oncogene. That's a gene that turns the healthy cells into cancer ones. Would it be fair to say that when the patch is heated up, it releases a drug and starts working?
Yes, when the patch is irradiated, it heats up and as a result it releases a drug that was attached to the particles directly into the tumor tissue, which enables deep tissue treatments of the tumors.
Can this technology be used to treat other deadly diseases also?
Yes, we view this technology as a platform technology that can be applied to different kinds of cancers and different kinds of treatments while delivering diverse types of drugs. It really has a tremendous potential to be transformative in the way we treat patients and the way we treat cancer.
That was Dr. Natalie Artzi, who is working together with Dr. Joao Conde, Núdia Oliva, and Eric Cha from MIT, and their research is published in the journal Nature Materials.